My name is Dave Wu, and I'm 67 years old from Vacaville. I noticed that I had some hip discomfort about 2.5 years ago. Felt like a hip pointer at first, and I thought it would go away, but it didn't go away. It got progressively worse. I couldn't bend over to tie my shoes. I couldn't put my socks on. It was really hard to, wash my legs because it was really the mobility was painful.
I first saw David about 4 or 5 years ago when he was having some activity-limiting pain in his hip. And his x-rays looked pretty good, but his activities, his badminton, golf, were restricted, and we decided to get an MRI.
But then he wanted me to do the MRI with dye to be a little more specific. And then that's when it came back where the cartilage was gone around the calf.
Eventually the pain worsened, so about 1.5 years ago he underwent hip replacement surgery here at NorthBay and did extremely well.
Everybody that I spoke with told me exactly what to expect. They gave me a pamphlet on everything I should follow, all my medication that I should be taking. It was very clear what I was supposed to do.
About a month after his hip replacement, and now I understand he's playing quite a bit of golf and may take up pickleball. So he's pretty happy right now.
Dr. Brooks told me 3 months, 12 weeks, before I could start riding my bike, before I could, start playing golf. And he was right on.
David is very healthy, super motivated, and I expected him to do well after his surgery. He did not disappoint.
I just don't have anything negative to say. Everything is positive. I would highly recommend him. I tell my friends that get it done, take care of your pain.